Hi, this is Jessica DaMassa from WTF Health. I'm here at Health Datapalooza with Anne Lamont. She's the managing director of Oak HCFT. All right, and tell everybody what that stands for because it took me a second right there.
So HCFT is healthcare and fintech because those are the two highly regulated areas that we work in, and there's a fair amount of overlap if you think about the amount of payments in healthcare between fintech and healthcare.
And that's an exciting space, I think, especially right now. There's a lot of talk about blockchain and the blockchain solutions that are coming out of fintech and being integrated into the health system. So is that kind of an area that you're looking at, or?
Well, not necessarily. I mean, we certainly do there are lots of business plans that have blockchain in them right now. We're not particularly focused on it just because blockchain is sort of a technology looking for a use case right now.
That's well said.
Yeah, right. So what we are focused on, for example, we've invested in a company, Giovanni Colella and Seth Cohn from Cashlight have started a new company called Ooda, which we've backed, and they are right in the intersection of fintech, of payments, and healthcare. And what they're trying to do, which I'm incredibly excited about, is simplify and take the friction out of the payment process for consumers, providers, and payers. And part of this will be RTA, real-time adjudication at the point of sale.
That's amazing.
Which would be incredible for consumers. And also, what they're doing is instead of having the provider take the responsibility for collection, the payer is going to be taking the responsibility for the collection of it all, for their portion and for the consumer portion, which is going to, if you think about just the friction in the provider environment for the doctor or the hospital system, then they don't have to focus on that. And the beauty of it for the consumer is you're going to have one contiguous bill where you understand, where your deductible, where your last payment was. And for the health plan, they're the one that has the contiguous relationship with the consumer, right? The member.
Yep.
The health plan, the hospital might see somebody once in there,
and that's it.
And that's it. So it's really exciting because one, we're thinking about healthcare in a different way. Two, just starting to chip away at the friction that's been created between provider and payer and consumer.
That is really exciting. I mean, like that shortens that whole revenue cycle for the provider. I mean, and it really, like you said, I think it builds that continuous relationship with the health. That's really smart. So what else do you look for we have a lot of startups that watch us. So I mean, what else do you look for when you're investing in a company? I mean, that's totally turn the payment model on its head. So like, is that the kind of like disruptive stuff that you're looking for?
Yeah, absolutely. I mean, I think the disruptive things we're looking for either on the Ooda side, like a Ooda Health or a Cashlight or Benefit Focus or Ooda, administrative efficiency. If you think about, 3 trillion, 1 trillion is just waste in the system, and part of that's overutilization, inappropriate care, and a lot of that is simply administrative inefficiencies, taking paper, digitizing it, doing things in workflow in a better way. So we're focused on that side of it, and then we're deeply focused on the care management side. Because if you really want to bend the cost curve in care, you have to be in some way dealing with patients, touching patients. And there are things like Quartet, where we are integrating behavioral health care with primary care. And that is all through software. It's a platform for enlightening primary care docs as to who has behavioral health issues that they're already serving, and then connecting those patients either with online services, telebehavioral health, CBT, or a local psychiatrist, psychologist, whomever is most appropriate for their care. So, creating a closed loop between the primary care doc and the behavioral health provider.
Okay, I was going to ask you. So I feel like over the last couple of years, we've seen a lot of point solutions, and we've talked to a couple other VC companies about the point solutions kind of going away. Is this a trend that you're also seeing, like this movement towards platform-based solutions or things that are more integrated?
Well, I'd like to say we've always invested in platforms. We're not interested. Many of the point solutions were for, it's not just for enterprise, but a lot of them were for consumer. I mean, some people thought that consumers would pay, and as far as I know, I mean, Fitbit, if you want to call them a healthcare company, 23andMe, is probably the only really successful consumer healthcare company right now. And so we've been very focused on platforms that can integrate care, because it really is all about care coordination in the system, and not individual apps.
Anything else, I guess, looking ahead, we always ask, what's the future? So what do you have your eye on coming down the pike? I mean, the investments that you look at that kind of create efficiencies and reduce the friction in the system, what do you have your eye on?
Well, there are so many things. I mean, we really focus on solutions for Medicare and Medicaid, and the duals is a huge area for us because, you know, if you think about it, we don't really focus on millennials and the worried well. We're very focused on where are the costs in the system, where are the pain points, who needs the help. And so where you think about where the deep costs are, it's the chronic comorbid patients, it's the dual eligibles, and that's where we're focused on creating solutions. And the beauty of like managed Medicaid or MA is that those, like Humana has a member for 7 years, an average of 7 years. So they actually have an incentive and an ability to influence patient care and patient behavior and have it affect their costs.
Their bottom line,
Exactly. So they're incented to have great solutions, and we are incented to provide those great solutions. I do think that primary care is a cornerstone of that, because the primary care giver really has to be the gateway for patients into the system. And I think we have a company called Village MD, which is an MSO for primary care, and they're globally capitating patients and taking on the responsibility of their downstream care. Because a primary care doc, people think of them as that $120 visit. The reality is, they're the cheapest part of the system right now, right? But if we enable them to manage downstream costs, they influence 70% of all costs in healthcare.
Really? I mean, they're the gateway.
They're the gateway,
truly, right? I mean,
they
everything
are truly
comes out
the
of
gateway.
everything comes out of there.
Right. So if we can, I mean, part of it has been access, part of it is where patients interface with the healthcare system.
Well, and part of it is like you are routed that way as a patient because of your health plan in a lot of cases, right?
Right. But you know, patients go to the ER as opposed to a primary care doc. They go to the urgent care. And the reality is we really need to have patients attributed to primary care docs, or at some level, and incent them to manage the downstream care.
And it's a pleasure talking to you and getting your insight. Thank you so much for joining me. This is Jessica DaMassa at Health Datapalooza. Thanks for joining us.